Okay, so thank you everyone for joining. I'm Dr. Sunjay Paul. I'm a senior lecturer here at the University of Buckingham Medical School, and I'm also the selection lead. Thank you. It's great to see so many of you joining, and I know many of you are coming from around the world, so it's really great that you are interested in coming to the University of Buckingham. So this webinar is designed to give you some tips and some guidance about how to prepare for both the MMA and MMI events, which happen within our selection processes. And if you do have any other interviews at other medical schools, you may still find this information useful. And if you do have any questions, feel free to post them in the Q&A section if you're watching this live on Zoom. We are also recording this and we'll put this on the YouTube channel. So if you're watching there, you could post it as a comment underneath the video. And one of our team members on this Zoom call will be answering the Q&A as we go along. Yeah, please keep it in the Q&A section rather than the chat. Okay, so this is our selection process at the University of Buckingham. There's a 3-stage process, and the first step is where the admissions team reviews each candidate's application and your academic qualifications to make sure that you meet our minimum requirements. And I'm sure you're wondering why our medical school, along with many others, have decided to create this additional form of assessment that I'm going to talk to you about today, in addition to your A-levels or equivalent exams that are already quite tough. And the reason that we do that is to give you the opportunity to show off some of the other skills that you have, because we know that there are many different attributes and values that are important in a healthcare professional. And the fact is that academic tests alone simply don't do a good enough job of highlighting all of the other skills that are important. Things like communication, team working, problem solving, to name a few. We also want you to prosper on our course. So we're looking at attributes such as your empathy and respect, as well as your own motivations for wanting to be a doctor. And so these MMAs and MMIs, which I'll go on to explain, are not just a test to rank you, but they're more of a way to give us a holistic view of you as a person, which go beyond just your academic qualifications. We also know that for traditional interviews, where you're asked questions and answers, people can easily prepare for those, right? And it's easy to try and do that. But while we understand that can give you a level of comfort to prepare for that and to know the exact right thing to say, our format allows us to be more discerning with the skills that we test for. Now, it's not to say you can't prepare for this at all, because that's what we're talking about today. There are steps that you can take that will be helpful. And so importantly, one of the main reasons that we do this is to help you level the playing field, because we know that many of our candidates will have a support network of people that can help with their application. People like their family, maybe they know someone who's a doctor or even works at a medical school. And while we know that that disparity exists and we can't prevent it, hopefully by creating an assessment like this, actually it will give an equal opportunity to everyone, because we're going to give you specific tasks or questions that don't necessarily have a single best answer that you can try and memorize in advance. So everyone is in the same boat. And so we hope that both ourselves at the University of Buckingham, but other medical schools, we hope that these kinds of assessments, these interviews, give us the chance to test your attributes, your values and motivations in a way that you just can't simply prepare for completely. But hopefully there are things that you can do to show the best version of yourself. So, as I mentioned, going back to our selection process, if you've already been invited to an MMA, you've already passed the first stage of this. So we look at the academic qualifications, make sure you meet the minimum requirements or are predicted to. And once you pass that threshold, then we look at this next step, our multiple mini assessment. And this is a written assessment. So you'll be given a 1 hour time slot to do this assessment online, and you'll be joining a Microsoft Teams call. You'll be logged in on your own computer at home, and you'll need to have your video cameras on so we can check that you're doing this on your own. And you'll be given 5 separate assessment scenarios or tasks. And you will need to type your answer into a Microsoft form. And each of these 5 activities are equally weighted, and they test several skills, things like data analysis, reflection, time management, ethics, but many others. And they're testing, again, these attributes and values, and these are mentioned in the GMC's Good Medical Practice document. And I'll go touch on that a bit later as well. After you've done your assessment in this 1 hour block, this will then be marked by our team of assessors, and we have a standardized mark schemes, and we will then be able to give you one of a few outcomes. If you perform well enough, you may be given a direct offer to study medicine. So the top scoring candidates essentially will be given that. If your score is too low, you may be rejected at that stage. However, for candidates around the middle, so you haven't quite achieved the highest marks or the lowest marks, but somewhere in the middle, and you've done relatively well, you may be offered either a place on our free medicine course, which is a 9-month course, and that's something that you do to sort of upskill before going into the medicine course, or you'll be invited to the next stage of our assessment process, which is the multiple mini interviews. This style of assessment is similar to other medical schools in the UK, whereas not many, if any, use the MMA that we use. And based on the MMI, then this second stage, if you're one of those initially middle performing candidates, we will then give you again one of those 3 options. Now, the MMI differs from the MMA. It's still an online test. It's still done remotely from home through Microsoft Teams. And again, you'll be given a time slot, which takes about an hour or so. But this time, you'll be rotated through 4 different stations. And these are essentially different calls with an assessor. And each station is either a discussion or conversation with an assessor, or it may be a role play with an actor. And bear in mind that while we do the MMI at Buckingham remotely and online, other medical schools may choose to do this in person, face to face. Also, bear in mind that different medical schools may use different online tools. So while we use Microsoft Forms and Teams, other medical schools may not use those same pieces of software. Now, I mentioned good medical practice, and as we are a medical school based in the UK, we follow guidance from the General Medical Council. And so both of these assessments, the MMA and MMI, are what we call blueprinted to the Good Medical Practice document. And in this document, it talks a lot about the values and attributes that doctors should have. So your first step in preparing for our assessments, a really good idea would be to look at this document, because this is the best way to understand what is expected of you. Obviously, it doesn't tell you the kinds of things, exactly what we're going to test you on and the exact way that we'll frame our questions. But by reading this, you'll get a good flavor of the kinds of things that we want to see in you. Another way to think about how you can prepare for these assessments is to consider these 3 different approaches. So when I refer to operational preparedness, what I mean is things like this. So reading all the information that we send online. Now, that may sound obvious, but honestly, it's often overlooked. And what we want you to do is to really thoroughly look at all the information that we send you out by email. So the admissions team will tell you the exact time and date of your assessment. They'll tell you what software you need, such as Microsoft Teams, and there'll also be information on our website that you might find useful. And I can't stress enough, it's really important that you read these things thoroughly in advance of the assessment day, because if there are any issues, you can let us know. We can try and find a solution. We also expect you to know how to use the platform. So if you've not used Teams before, if you're used to Zoom, for example, it'd be a good idea to download Teams in advance and get used to using it. Make sure you know how to set up your headphones, make sure you've got the downloaded the most up-to-date version. Make sure your audio is working in the morning before you actually join the assessment call. So do all the little things correctly. Again, you'd be surprised. Some people really don't get those things done properly, and it leads to issues and delays on the day. But these are simple things that you can do. Also, make sure you're in a quiet environment. So that's in your own bedroom. Make sure your door's locked and no one else can enter it so that you don't get disturbed during the assessment. And make sure that you've got a good internet connection. So if you're in a part of your house that you know doesn't have good signal, find somewhere else. And try and anticipate and fix this in advance, because if you do have a tech issue on your side, there's little that we can do on the day. And speaking from recent experience, actually, I just want to remind you of the importance of doing this in a place that is quiet and has good internet connection. It's not appropriate to join these kinds of assessments while you're in a car, obviously. Hopefully that should be obvious to you, but clearly that is unprofessional. Now let's think about motivations, and hopefully, again, these are relatively obvious, but it's important that you show us that you know the answer to these questions. Now, we may not bluntly ask you why you want to be a doctor, but we would hope that your enthusiasm and your realistic understanding of what the job requires is something that comes out in any response that you give. And some of this may correlate with your personal statement, so it'd be worth looking at that before you come to these assessments as a refresher of what you're all about. But we're really interested in what you have to say and knowing why you have chosen not just why to study medicine, why you want to be a doctor, but why you've chosen our specific medical school. And there are dozens in the UK. So why this one? What appeals to you about our course, our campus? And why do you believe that you'd be a good fit for our university? Because as much as we think that we do a good job of teaching you, we want you to know why you will fit in here. We also want you to think about the values and attributes that are important in general, as a doctor, as a healthcare professional, and these might be your own intrinsic values, but also and what makes you think that you would be a good doctor, but also the values from the GMC's good medical practice. And also look at the NHS's values, the National Health Service, which is that in the UK. And whether you're applying from the UK or not, it's worth looking these up, because these may not be immediately obvious to you. So it's worth familiarizing yourself with these. And also, again, consider the values of the medical school that you're applying to, and ask yourself honestly if those values align with yours. So for one example, some medical schools teach the clinical side of things where you see patients quite early on, whereas others may focus more on the theory without giving you many patient interactions in the first couple of years. So do you think that your style of learning fits with one of these approaches or not? And thirdly, are you able to reflect and think about your own needs and the needs of others? Can you think critically and show your opinion, and whether you would change your opinion when presented with new evidence or not? Some other little pieces of advice on what you can do to prepare. And this isn't complicated, and I'm not going to read these all out to you. I don't mean to patronize you, but again, you'd be surprised at how many people make mistakes here. For example, when reading the instructions for a question, look at how much it's worth. If one question is worth 2 marks, but another is worth 10, hopefully you would recognize that we might be asking more of you with a question that is worth more. So you might want to adjust the time that you take accordingly. And as I mentioned before, try and avoid having pre-prepared statements, because generally that means that you're not really answering the question that we are giving you. You're trying to answer a question that you think that we're trying to ask. And of course, make sure that you are polite, respectful, and stick to the rules, as you'd expect any doctor, any healthcare professional to do. This advice is more for the MMI, the interviews, because you'll be speaking to an assessor or an actor in a one-to-one conversation. And although you are speaking them through a camera and not in person, bear in mind that you might miss some of the normal social cues that exist. So it's even more important to try and demonstrate things like eye contact. So looking straight at the camera, for example, and it's easier if you move the window of the Teams call closer to the camera on your device. And try and use active listening techniques, so nodding your head to show that you're listening. Again, you might not be so comfortable doing that online on a video call, whereas you may do that naturally in person. So try and prepare yourself for that environment. We also want to make sure that you are free from your own distractions. So stick to having one screen rather than having one display here and another one over there, because that will break your eye contact. And make sure you close all other tabs and applications on your device. We want your experience to be smooth. We don't want your computer to crash. And we also don't want you to be distracted and looking at another browser, for example. If you have a device that you can turn on do not disturb mode on, that would be a good idea so you don't get any distracting notifications. We also ask that you keep your camera on the whole time so that we can see what you're doing, and we need to make sure that there's no one else in the room with you for obvious reasons. But we also will ask you to mute at times when you are not speaking, and we'll instruct you when to put your microphone back on. If you are in your own bedroom, make sure the background is nice and clear. So if you've got some distracting posters or artwork, maybe find a different area of your house with a blank wall. We don't want to have anything that will distract the assessor from focusing on you and what you're talking about. Now that I've talked in some general terms about to prepare, let's talk about some practical ways of preparing. And one option is to speak to your friends and work together to think about how we might assess you. So it would be really helpful if you can come up with some good ideas for your own station. So put yourselves in our shoes. Think about what's a good way of testing a student's empathy, or how do we test if someone's respectful of other people? What questions would we want to ask that candidate? And that's something you can do yourselves. You can do that right now. And if you wanted to, for example, figure out someone's motivation for medical school, what questions would you ask them? Some other recommendations, I would strongly recommend to read about current areas and interests uh, and topics for debate in medicine right now, whether that's in the UK or around the world. So what are the issues that are affecting doctors and patients right now? If there have been strikes, for example, what are doctors striking about? If you think about the pandemic, what were their issues that arose there when we were trying to figure out things for the first time? Another thing you can do, and this again is something I can't recommend strongly enough, is to talk to people. And it might sound silly, but I can't overstate how important it is to work on your communication and understand how people behave and react, not just for the purpose of an assessment, but to be a doctor. And the best way to speak to people, typically to improve on your skills, is actually to do this with someone outside of your usual social groups and not just with your best friends, because it's very easy to talk to someone who you connect with socially in any normal context, or someone that you like and someone that you get on well with. But you might find it more beneficial to talk to someone much older than you or even younger than you. And it can yield some very interesting conversations. And talk to someone outside of your own socioeconomic group, outside of your own nationality, outside of your own gender. Gaining different perspectives on different things that might go on in society is really, really valuable. And it will feel difficult or uncomfortable if you're not used to that. But that's how we grow. That's how we get better at conversing with other people. And if you're not sure how to go about this, how to meet people in these different contexts that you're not used to, there's lots of different ways. So could be through a job that you have, whether that's a paid job or maybe a volunteer job. Maybe you should go and work in a place that you can get that exposure. Could even be just talking to someone in the queue for a coffee shop that you're at. Either way, just make sure in preparation for a communication kind of interview, don't just sit in your bedroom trying to learn how to understand people from a YouTube video or from reading a document. You've got to get out there in the real world and actually communicate and learn from others. That's the biggest advice that I can give you. I've mentioned looking at the GMC's documents, in particular good medical practice, and that is, of course, a good starting point. Something else that I think is underutilized by people looking into going to medical school is to practice your ability to reflect on your actions and your behaviors and your skills. And reflection is challenging. It's not what most people think. It's not just recalling what happened, but it's actually identifying learning points from something you've experienced. So if I was to take this webinar as an example, and I asked you right now, how do you reflect on this? What I don't mean to say is that I want you to give me a summary of what I've said. I'm not interested in that. We know the facts. I've told you that already. What I'm interested to know is what is the impact it's had on you? What have you learned from this? What are your learning points? What did it make you realize that you had no idea about before today? And what will it change about your approach in future? And that is again, another really important piece of advice, aside from just communicating, to develop those critical appraisal skills, not just of other people and situations, but of yourself, because that is again how you can demonstrate how you grow and how you learn. And is a skill that is really important, not just, again, not just for an interview, but as a doctor in general. Okay, and those are the main bits that I wanted to cover. Um, I'm just going to signpost now some upcoming webinars with some interesting topics that you may find useful, and I would recommend that you join these. We'll also be posting links to this in the chat below right now. And if you're interested in visiting us at an open day, and I'd thoroughly recommend that, again, not just as a reason to come and see us just to tick a box, but for your own benefit. Do you actually want to come here? Do you like our campus? So I'd thoroughly recommend that, especially as you'd be potentially spending the next 4 to 5 years of your life here. Don't just turn up without having even thought about what it's even like to live here. And before we go on to the Q&A section, just a reminder of some of our social media channels. We will be posting, for example, this video, and I would recommend that you watch this again, or if you only caught the end of this because you're a bit late, then you can watch that on our YouTube channel. But also we'll be posting other useful pieces of information about the university in general on our various social media channels. Okay, so I'm now going to move on to the Q&A section. If you do still have questions, feel free to continue to post them. Either myself or my colleagues will respond to them. Okay, so the first thing is, what are the timings for each station of the MMA, and will you get follow-up questions? So for the each station, sorry, in the MMI, it's 8 minutes in the MMI. So you'll get 1 minute where you'll be able to read instructions. They'll be shown to you on screen. Essentially, there'll be a PowerPoint slide with some short instructions, and then you'll have 7 minutes to carry out the interview. So there are different styles, and like I said, it might be a conversation with an assessor, and the instructions might say you'll be asked your opinion on this topic, and you'll then need to talk about that with the assessor for 7 minutes. Okay, so each station is 8 minutes, 1 minute of reading, and 7 minutes to talk. Second question I've got here is what type of questions can we expect to come up on the MMA? So I can't really give you any specific examples, unfortunately. But I'm sure you can understand why that is. But we're going to test the kinds of things that are in the Good Medical Practice document. So if we wanted to test, for example, your time management skills, you can imagine, how would we test that? What questions would we ask to test that? That's the way I'd go about it. So I would go through the Good Medical Practice document. Essentially, there are bullet points that say we want a good doctor to be able to do this, or to do this, or to think in this way. Go through that and think, how are we going to test that? But yes, unfortunately, I won't be able to give you the specific kinds of questions, unfortunately. So someone's asking, during the assessments, in the 1 minute reading time, are you allowed to make notes? Yes, you can. You can make notes, and certain questions may require the use of a calculator. and you can do that as well. You can use a calculator if needed. Another question is about the MMA, but I think this will be relevant to the MMI as well. Are questions subject-based or personal? Um, it could be a mix of both in that we might ask for your opinion or how you would react to a certain situation. We might ask you to show your thought process. If you're given a scenario, what would you do in this situation? So that is a personal thing, or it might be a topic. So it might be, can you explain the benefits and disadvantages of this certain thing? So it could be a mix, but again, we want to try and give you the chance to show what you're all about. So you can certainly use your personal experience in answering those questions. We want to see that. Does the MMA have multiple choice type questions? It might, not necessarily. It can be written out questions. It may be a multiple choice. It may be one where you choose the best answer. There can be a mixture of things. So the next question is, what personal questions, such as motivations, attributes, and personal statements, might be asked more in an MMI than an MMA? I can't go into too many specifics, but I guess it's the difference with an MMI and MMA. Remember, you're speaking to in person, right? So the MMI, the interview, lends itself to more of a conversation. Okay, so if we really want to go into depth about your thoughts on a contentious subject or some sort of ethical gray area, it's in some ways easier to do that with an interview, as I'm sure you can imagine. However, in some ways, it might be easier to write an answer down to give a balanced argument of the pros and cons of a situation. So it's hard to say, but in general, I would say if it's a topic that we might want to get out the nuanced details, it's a bit easier for us to do that through an interview rather than a written answer, but not necessarily. Someone's asking, what is the chance that you'd get an MMI instead of a pre-med offer after completing the MMA? It's hard to go into the specifics of the percentages. It really depends on how people perform. So the top performing candidates will be given a direct offer, as I mentioned. I'll just scroll back to that screen with the flow chart so it's easier to understand. But we don't really have any set percentage that we're going to say, okay, 10% are going to be offered the MMA and 20% are going to be offered the MMI. It depends on how you perform. And someone's asking what kinds of questions will be asked. Is it more hypothetical or personal? It can be a mix of both. It could be asking how you'd respond in a situation, or it could be using your own experience. Can you tell us a time that you have done this in the past that has demonstrated this attribute, for example? Someone's asking, do you have postgraduate medicine for international students? At the university, at our university, we don't have a specific postgraduate course. Other universities in the UK do offer that for medicine, but we don't at Buckingham. However, I can say that there are many students who are postgraduates who join our undergraduate course. So they may have done a 3-year degree or shorter elsewhere, and they decide, actually, I don't mind doing an undergraduate course, even though I've done that before. And that's up to you if you'd like to do that. Someone else is asking, how do you recommend in terms of revising for the MMA? How difficult is it? So again, those things that I mentioned before, I'll just open up those slides again. Let me just get the right one. So remember the kinds of things that we are looking for are looking at the good medical practice document. So I recommend trying to keep up to date with current medical topics, having an awareness of the issues and challenges that face doctors and patients. I would immerse yourself in the world of healthcare. That's the best way to try and prepare yourself. Um, Someone's asking other questions in the MMA scenario based. Yes, they can be. So we might give you a scenario and ask you how you would respond in that scenario. So yes, it could be. Someone's asking, are there any hints of questions that could come up in the MMI, like a sample video? We don't provide that, unfortunately, but uh, those kind of things do exist online. So feel free to use those. I'm also aware that there are some paid for courses. We don't recommend or encourage anyone to do those. Um, it depends on whether you would find that kind of thing valuable. But we definitely don't encourage anyone. We don't think that is necessary to go on any paid for courses. But to get a flavor of what to expect, there are plenty of things you can find online. There are plenty of um, websites and educational, preparational resources that exist if you want some examples. Um, Someone's asking, will we get a question? We'll be able to see the question after the 1 minute. So, for example, if you're in the LMI, the interview, you're given the 1 minute to read the instructions on screen, and then you've got 7 minutes. And I guess you're wondering if you forget. Yes, you can always ask the assessor, can I go back and see that instruction slide again? And they'll open that up for you or repeat the question. That's not a problem. Someone else is asking, would it be more practical based questions? For example, what would you do in this situation rather than personal experience? I wouldn't say more or less, but there can be a mix, as I've said before. Someone's asking how similar or dissimilar is the MMA with the UCAT? I would say it's a different assessment. If it was the same, we would use the UCAT, but this is not that kind of assessment. This is different. So there might be similarities in the kinds of things that we ask, but I would say it's a different assessment to that. And someone's asking what kind of calculator questions. We're not going to be asking you about to do differentiation or integration or trigonometry. We'll be asking you the kinds of calculations that might be useful as a doctor, not giving you, a specific medical context necessarily. I'm sure any of you that have uh, considered applying to this will have the necessary math skills to be able to answer these. They're relatively straightforward maths questions, but I can't go into any more detail than that, unfortunately. Does the MMI test skills that may not have been covered in the MMA, or is it possible that we could ask a skill that has also been asked about in the MMI? Yes, we could ask a similar kind of question in the MMI to the MMA. And it's typically something where we might want a bit more detail or more nuanced view on something. Someone else is asking, does any controversial opinions you may have affect the results? It can. So like I said before, we're looking for people who have values that align with those that are expected from the GMC's Good Medical Practice, the NHS, and our own medical school. So if you give a personal point of view that is controversial and is not the kind of viewpoint that we think would allow you to prosper on our course and in a healthcare environment in the UK, then yes, that may affect how we mark a response. Someone's asking, is there a word limit for the answers in the MMA? Some of them will be short answers where we will explicitly say you just need to put a 1 or 2 word answer. Some of them will be open and you can write as much as you want, but typically the time issue will restrict some people. Another thing I want to just mention on that point, actually, I mentioned before about professionalism, and one thing that we will also be checking for is the use of AI. We understand that it is very easy to use AI these days. And while AI has a place in learning and in education, it does not have a place in assessment, and particular in our assessment process. So we will have a very hard line on anyone we suspect of using AI in any of their responses, whether that's in the MMA or the MMI. And we reserve the right to exclude people from the assessment process if we suspect the use of AI at all. So I want to make that clear. And on the day of the assessments, we'll also reiterate that we have several tools that we can use to identify anyone using AI. So I want to put anyone off taking the chance, because if you do, you will be excluded from the process. Someone's asking another question about whether the MMA contains questions about biology and maths. It can. We're not necessarily testing specific content from biology A level, for example, because we know that not everyone will have sat that because we have international applicants, but it might be applying a concept that you may have learned in biology, or applying a concept you may have learned in maths, such as percentages, for example. But that's about as detailed as I would go into that, answering that. How long will the breaks be between stations during the MMI? Typically a couple of minutes. So in the MMI, you'll be on a Teams call. You'll then be asked to join a different Teams call to speak to one assessor, and then move to another one. In between, there may be 1 or 2 minutes. But we wouldn't expect you to be able to leave and go to the toilet, for example. If you had to in an emergency, obviously you would let us know. Okay, someone's asking how many applicants will get an offer. So again, it's hard to give an exact figure for that, but we have each year the number of students that actually join the course. So the final number is around about 230 students, something like that. As you can imagine, we need to offer more than that because some students may be offered in 2 different medical schools, so they may not come to us. So our offer rate is always higher than the final number that come in. So I don't have a specific answer for that. And someone's asking, if you complete the pre-med course in May 2026, will you have to wait for January 2027 to enter? Yes. So that's right. So you'll enter the next cohort for the medicine course. Someone's asking, are you able to put bullet point answers for the MMA, or does it need to be continuous prose? It depends. And again, I'll try and use your intuition in the way we phrase the question. If we're asking you to debate the merits of something, the benefits and disadvantages, it might be better to do that as continuous prose. Whereas certain questions may be acceptable to write bullet point answers. So I'd leave you to judge that. If you're unsure, generally it's better to write in continuous prose, isn't it? Are we to expect several questions with the same station? Would all questions be relevant to the scenario? So we may ask several questions. I guess you're asking that within the MMI, the interviews. So yes, there could be follow-up questions within that. Typically, they would be related to the same topic, though. We wouldn't go completely off course and ask you something completely unrelated. Someone's asking about, they heard that at the University of Buckingham, our Crewe campus is closing down, and would there be any changes in facilities? So yes, any new students that are applying will be placed in Buckingham. So our Crewe campus is having a phased closure. So there, as of this year, there are no new students going there. Any students that were previously there are completing the course and their placements there. So they are not affected, but you won't be placed there. Someone's asking for the postgrad to medicine program. If we have to do the MMA and MMI. So anyone applying to our medicine course, like I said, to go through the flow chart, you would have to go through applying through the MMA, and if you're successful, you may be given an offer straight away, regardless of whether you have done a previous degree or not. So you still go through the same selection process. For the MMI, do we have to talk for the complete 7 minutes, or is it more of a conversation? And are we allowed to refer to notes? So yes, You don't have to talk for the full 7 minutes. If you answer all the questions before that, that's fine. But it tends to take about 7 minutes in general. Is it more of a conversation? It might be a conversation. It depends. But yes, in general, I would prepare for that kind of thing. And are you allowed to refer to your notes? Yes, you can. How many stations are in the MMI? Someone's asking, so I'll just bring that slide up again. It's 4 stations. So I'll put that there. So yeah, there's 4 stations in the MMI. Let's have some water once again. Someone's asking, can you please explain the difference between pre-med offer and MBCHB? So MBCHB is that is our medicine course. That is our main course. That's 4.5 years. Pre-medicine is a sort of like a foundation course. It's to get you up to skill because we think that maybe at your level you need to upskill before you'll get to the level where you're ready to start the actual medicine course, and that is a 9-month course. There's more information on our website, so I'd recommend looking at that. So pre-med is 9 months, but the full MBCHB course, that's a medicine course, that is 4.5 years. Someone's asking if the question is an essay, how many words should the answer be? It's hard to answer that question really, but I'll judge that by the number of marks that it is worth. There's no, sometimes it could theoretically say what we expect you to write, but it won't necessarily do that. So I'll judge that on how well you can answer that. But if it is like an essay type of answer, probably the restricting thing will be time anyway. You won't be able to write pages and pages of things because that's not really an option. Someone's asking, what is the ideal MMA candidate? So it's someone who displays all those values and attributes that I've talked about from good medical practice and the NHS and the medical school. So someone who's ticking all those boxes, that's showing us they have all of these skills aside from just the academic competence. And someone's asking how you prepare for the MMA. I think I've answered that already. In truth, I've given you some tips. So I'll try and practice with friends, try and anticipate the kinds of things that we may ask you based on the skills that we're looking for. Someone's asking, does the University of Buckingham help to get into the foundation year training program? So yes, every single medical student in the UK is automatically put into the foundation training program once you've passed your final exams at the end of medical school. So yes, that happens for everyone. When will the MIs take place? So usually they take place about 3 or 4 weeks after the MMAs. So our next ones coming up, I believe, are in May. So you should have plenty of warning before then. How many questions are there in the MMA and how much time do you have for each question? Are they worth the same marks? So each activity in the MMA, so there are 5 activities. Let's open that slide again, is weighted equally. So you can do the maths. Each one is you have about 12 minutes in total. But there's a bit of buffer time in between that. And there may be, so one activity may have just one question and some may have a dozen questions because they're shorter answers. What is the procedure if I have a technical issue in the middle of my MMA? If we can solve that issue quickly, then we will. If we can't, there are a couple of options, but I would just suggest don't panic. We will find a way to solve that issue, and if not, we'll give you guidance. But don't panic if that happens. That does occasionally happen, and we have solutions for that. So don't worry if your computer crashes in the middle, we will give you another opportunity in the selection process. Will we need to explain simple biology chemistry concepts at any point? It is possible, but like I said before, it's more about your application of knowledge rather than testing a specific thing. So I'm not going to ask you um, to explain photosynthesis, but I might want you to explain a concept that you have learned that is possible. Um, it's more about the application of knowledge rather than testing specific facts that you have learned, because you're doing that already. We're trying to test other skills that don't come up in academic tests. Will we have more webinars like this? Yes, so I'll go back to that slide at the end. If you'd like to join, here is a list of our other webinars and our other web events that we host. Someone's asking, can extra time be offered for those disadvantaged with typing? Yes, we do. So we call that a reasonable adjustment. You need to let us know in advance. We will then review if that counts, and we'll let you know if we can offer you a reasonable adjustment. So yes, of course. Someone's asking about admission statistics for the University of Buckingham, the number of applicants versus the number of offers. I don't believe that's something that we publish, unfortunately. So yeah, I don't think that's something we publish, but I'll let my colleagues answer that if that is something we can do. Someone's asking for the MMI, would we need to refer back to some of our MMA answers? No, that's not really expected of you. These are separate tests. So no, we wouldn't be asking you, what did you say in that MMI? It's a different question typically. Someone's asking if more than 40 candidates in the MMA meet the requirements for pre-med, can the uni accommodate this? So we leave that to us. We figure that out. It depends. But I would focus on just doing as well as you can. And same for anyone who's wondering about, the chance of success. I can understand why you think about that and why that worries you, but honestly, that's something outside of your control. I would focus on what you can control, and that is performing to the best of your ability. Will there be follow-up questions in the MMI? Yes, there may be. So we might ask you an initial question and then ask you some follow-up questions after that. Will you be around to refer to notes? Yeah, I'll answer that. Yes, you can. Someone's asking, will you be eligible for pre-med despite not having done biology A-level? It depends. I'd have a look at the requirements on our website, which are quite clear there. So have a look on our website. When we hear back after the MMA, it's usually 2 or 3 weeks. So we mark those and then we tell you if you're going to get an offer or an interview. Do most people who take the pre-med make it into the medicine program? I don't have those exact statistics on me, unfortunately. I'll see if one of my colleagues can answer that. Someone's asking, is foundation training program mandatory before residency, whether that's in the UK or abroad? Yes. So in the UK, you must complete foundation training, which is 2 years after medical school, to be able to then apply to residency. In the UK, we call that slightly different, but essentially it's residency. We just call that a training program here in the UK. So yes, you must complete that. If you would like to move abroad before then, so you finish med school and then move abroad, it depends on where you're going to and whether they accept that. But many other countries require you to have done the foundation program as well. So I would check. Someone's asking, how is a student designated to a foundation program? So that it may change by the time that you finish medical school, but at present, is it applied based on is it designated according to a ranking process? So we ask, so every medical school, every single medical student, once they've passed their final year exams, they are asked to rank every single position in the foundation program. So, and that will be hospital jobs up and down the country. And then they are assigned according to rank, and they try and give everyone their top choices. But as you can imagine, that can't always happen. but that's what we try to do. And that's run separately to us. It's not by the university. So it's assigned based on your preferences. How many months in each semester? So yeah, each semester, each term, as we call it, is 12 weeks. And there's 3 terms per year. So yeah. Someone's asking if we have a disability that might impact speech, such as a stutter, or prevent conveying of emotions. Can we still apply? Yes, of course. And we, as I mentioned before, we give reasonable adjustments for those kinds of things. So yeah, don't let that stop you from applying. We try and, like I said before, have a level playing field for anyone who would like to apply. And after foundation training, could you go to the US? Someone's asking. Yes, you can. So you can apply anywhere else you like. But it's up to you to do that. We can't really help with that process. We don't offer that. We aim for our graduates to be prepared to go through the foundation training program, and from that point onwards, it's up to you where you decide to apply. For the MMA, are you allowed to have a notepad? Yes, you can. I'm just going through the questions. Some of these I'm going to repeat it. So yeah, there's a few repeats. Let's see. Does the second year of medical school also start in January? Yes, it does. And yes, we'll be offering you these answers in written form as well for today's webinar. So any questions will be shared with everyone. Someone's asking, is the conditional offer based on achieving 70% overall in the pre-med guaranteed pathway? So for example, if you achieve that, is there a 100% chance of being accepted? I think someone's going to answer that for you actually. Can universities see other offers that you have? Does this affect your chance? No, it doesn't affect your chance. We judge you based on your performance and apply to as many other universities as you like. I'm not sure if others do the same thing, but in general, no. It shouldn't prejudice if you're applying to more than one place. And someone's asked me to clarify the ranking system. So what I was referring to there is the foundation training program. So after you finish medical school, essentially you're given a list of all the hospitals that exist in the UK, and you are asked to rank them. So you can put wherever it is, Northeast London first, or Manchester second, Birmingham third, all the different places. And based on that, they look at everyone's and put it into an algorithm and then try and match as many people to their top choices as possible. So it's based on preference. What facilities are available at the Buckingham campus? I'd suggest having a look at our social media channels for that. So I'll go back to our links there. It's worth having a look, and on our website. So we've got all the usual things. We've got a gym, social spaces, bar, places where you can play sports. So yeah, there's lots of things on our campus, which is a really lovely, beautiful campus. And again, I'd recommend you to come and visit. Are the holidays shorter since it's a 4.5-year course? And does this affect mental health? The holidays are slightly shorter than other places. We do think that it is manageable, however. And does it affect your mental health? I guess it might if you're struggling, but most of our students are okay with that, and they manage well. It's just a case of being preparing well and not leaving things to the last minute is usually the best way of keeping on top of your work. And if you're struggling, we do have a very good student support team that can help you if at any point during the course you're struggling, whether it's with the course itself or things outside. And any medical school offers that kind of help. So I wouldn't say that the shorter holiday time should negatively affect your well-being in general. But if you think it might, and if you're the kind of person that needs some downtime, then maybe this course isn't for you. Someone's asking, is it possible to make exceptions and accept places if you miss the mark by 1 or 2? I think one of my colleagues is writing an answer to that. But generally, we set a cutoff level, and that is a level that is set. So we can't typically make exceptions afterwards. How many holidays do you get per year? So at the end of each term, you do have a short break, um, and that depends. The length of time varies between a couple of weeks to a month or so, depending on which year you're in. Someone's asking, how costly is the foundation program? Is this a must? Um, so you are paid on the foundation program. That is a job you are given. So it doesn't cost you anything. You'll be That's when you start working as a doctor. Um, and someone's asking, as a Canadian student, can you apply directly for residency? You can, but my understanding of it is that you may need to complete the foundation program before applying to Canada and many other countries, or at least completing foundation year one, because you have what is known as a provisional license to practice as a doctor after finishing medical school, and that only becomes a full license after completing the first year of foundation training. But generally, like I said, most places want you to complete at least the first 2 years of foundation training before you can apply to residency in other countries. But I would look up the specifics. Um, Someone's asking, what's the criteria to score higher on the MMA? It's not a criteria as such, but it's based on your mark. So if you score really well overall in the MMA, if you get a high score, then that's how we offer you a place. Um, what can you do to stand out as a student in the MMA apart from the advice? I don't think there's anything else I'd mention. We're looking for people who exemplify the kinds of characteristics, attributes that we would like to see in a future doctor. Um, oh, sorry. So someone's asking a clarification on a question they asked before about medical facilities that we offer at the campus. So medical training dummies or anatomy tables. So yeah, we have some exciting stuff. So we don't teach through dissection, which is when you have a cadaver. Um, we do, however, offer anatomy teaching through a variety of other methods. So we have 3D models, we have virtual reality devices, and also virtual reality um, or immersive software that you can use on your own device, laptops, tablets, etc. And we also have um, a tabletop. It's called anatomage, and you can look that up. It's quite cool. You can look at a body on this, essentially a monitor that's flat on the table. Um, in terms of other things we teach clinical skills with clinical devices, dummies, so you can practice listening to heartbeat on that. We have digital stethoscopes that you can use. We have um, a new virtual reality clinical simulation software. So you can use this with a VR headset or again on a laptop or a device, and you can practice seeing a virtual patient, which is really cool. Um, so yeah, someone's asking, what is the ratio of home and international students? Um, Generally, it's something between it's about 75% international students compared to about 25% domestic students. And that's just because of the number of people that apply. It's not that we set a bar that there needs to be this number of domestic or international. It's just that's how many people apply, that's how many get in. Generally, that's what we tend to see. Um, So someone's saying that they've read through the General Medical Council guidelines, but they're very broad. And they're asking, how do you think that we interpret that in an MMA setting? Um, yeah, I guess we're trying to figure out how we test it. I can't give you really any specific answers more than that. I would try and yourself try and think about how do you put this into practice. So if, one of the attributes it says there is that we want you to exemplify empathy. A good way of you practicing that is thinking, how can I demonstrate that I'm being empathetic? And that is by speaking to people, practicing that. And someone's asking, is the MMA always the first stage of the process? Yes, so you need to have passed the academic threshold, and then you have to do at least an MMA. And from that point onwards, you may either be given a direct offer or be invited to the MMI. But yes, you have to have done the MMA at least. Um, so someone's saying since there is no strict criteria, how do assessors decide between a strong candidate and an average one? There is a criteria. We have a mark scheme, but that depends on the specific station that you're doing. So I can't tell you what that is. But we do have very specific and standardized criteria so that everyone is marked fairly and equally. And we go through a process where all of the assessors have a what's called a calibration where we make sure we're marking in the same way to ensure fairness. Someone's asking, how does the ABB offer work if you have 4 A levels? Will it be based on the three best ones? Yes. Um, will you be given a timetable? Yes, you'll be given a timetable of specific classes and times in your second and third years. There is also a module that you will do that is your own choice. That's called a student selected component. And we have a variety of courses on offer there. But that is one module in year 2 and year 3. But the majority of the course is set out for you. And that's pretty much the same as any medical school. So you have a number of modules you have to do, but part of the course is selected by you. What are common mistakes that candidates tend to make? So I've talked about some of the things already, you know. So for example, we ask you to reflect and you don't reflect, you just describe. So I gave you the example of how you might reflect on this webinar. So if I was to ask you to reflect on a situation, try to think about that, what that means for you, how that changes you as opposed to just describing. Um, Someone's asked, once being invited to an MMA, are your academic results still considered? Are those used in the ranking? No. So the academic performance, that's the first threshold. Once you've passed that and you're offered an MMA, we don't need to look at your academic performance anymore. You've passed that stage. So it's just decided on the MMA and potentially the MMI. Is there an option for intercalation? No, not at the University of Buckingham, but other universities in the UK do offer that for their medical schools, but we don't offer that at present. Is there a dress code like no piercings on the lip? We don't set an explicit dress code, but you can find dress codes for general things like interviews or working in a healthcare environment, and it may be useful to follow that advice if you're unsure. If someone gives a technically correct answer, but doesn't get a high score, what would be the reason? It's hard to answer that without giving, you need without giving a specific answer to one of our scenarios. If you perform well and say all the things that we would expect you to say, we have a mark scheme, and if you say everything on that mark scheme, you'll perform well. If you miss the point completely, then you won't. So yeah, we're not trying to catch you out with any of these questions, whether it's in the MMA or the MMI. That's not the way to think of it. We're trying to give you the chance to shine, to perform at your best. Do you have to wear formal for the MMA? You don't have to, because it's a written assessment. But as with any interview, any assessment, it may be sensible to dress in an appropriate manner as opposed to an inappropriate manner. But no, there's no formal dress code as such. I was asking, is there a format for writing the MMA? Not necessarily. You don't necessarily need to, but if you need to, it may be written. We will give you a specific instruction. If in doubt, it's better to write out full sentences rather than just bullet points if you're unsure. Is eloquence and grammar part of the marks? It depends. It may be. It depends what we're testing. And one of the things that may be useful for us to assess if you're going to do well on our course is if you have a good command of the English language, because we teach in English. So that may be required for certain answers. Someone's asking if you can ask current students at the University of Buckingham, if you know them, to help with the MMA and MMI. No, I would not recommend doing that. Partly because we actually changed the process, so that wouldn't be particularly useful. Everything I've talked to you today would be helpful to you, and I don't think it'd be any more beneficial to speak to someone else, even if they've done it before, because we do change the questions for both the MMA and MMI to try and prevent people who may know people already from getting an advantage. Someone's asking if you completely mess up one station, can you still pass overall? Yes, you can. So, we take the marks overall. So yeah, if you struggle with one station but do really well in the others, yeah, you certainly can. Um, Someone's asking, would practicing for the SJT on the UCAT help for MMAs? So we may include that kind of concept, situational judgment tests, but not necessarily. So if you've done the UCAT, you may find that helpful, but can't really be more explicit than that. We may include that or we may not. It depends year on year. Do you get a lot of one-to-one teaching at this university? So we have a tutor system. So um, every student is assigned their own personal tutor, and they are there to help with support, guidance, go through feedback from exams. But in terms of teaching as a whole, generally that is done either in a large group in a lecture setting or in small groups of 8 to 10 students. Um, and occasionally you'll have one-to-one teaching, but generally it's small group teaching. Um, Someone's asking if you have an MMI, does it happen on the same day? No. So the MMA happens first, then we mark them, then we give out the results and invite you to the MMI, which is usually a few weeks later. Um, Someone's asking if you prepare using medical ethics case studies, role play, would that be enough? I think that would be useful. I wouldn't say it's necessarily enough because there's different skills that we test. Um, we test things like data analysis as well, which may not come up if you're just practicing in that sense. And we may test on current hot topics, as I mentioned before. So I wouldn't say that's the only thing you should do. I just realized I'm still sharing my screen. I'll stop that. At the university, is there early patient contact? Yes. So I think my colleague is answering that, but yes, we get you to see patients early on. So we rotate you through GP placements, hospital placements, and we also get you practicing with actors as well. So yeah, we get you involved very early on, and that's one of the benefits, I think, at the University of Buckingham compared to other courses because we give you that early exposure. Um, will the MMA be time pressured? Yeah, there is a bit of a time pressure. Some of the questions are hard to respond completely in the time limit you have. So yeah, there's a time pressure there. We try and do it fairly so it's not completely time pressured. But yes, there is a time limit. So yes, you could say it's time pressured. Someone's asking, is there a transport system in the campus that is cheap for the students? So in the campus, everything is walkable. It's a relatively small campus compared to other places. So you can walk. In terms of links to Buckingham, have a look on our website and our social media channels. But yes, there are plenty of bus services, trains to the nearby big cities, to London, for example, Milton Keynes. What's the graduation pass rate? So most students pass by the end. I don't have the exact figures, but we don't have that many students who drop out, as far as I'm aware. Um, okay, I think we've gone over an hour now, so I might pause there. Um, we're getting some similar questions. Um, if you haven't had an answer responded to yet, we'll post those answers afterwards and share the responses with you. But have a look on our website, have a look on our social media channels, um, and if you have any other questions, let us know. You can contact us. If I just share that final slide again through our social media channels. Okay, so thank you all for your questions. I'm now going to and the webinar there and the recording. And I hope you found this useful. If you would like to join any other webinars, please click on these links or use a QR code. And I hope you found this useful. Thank you.